Folic acid, a synthetic form of folate, vitamin B9, is crucial for women of childbearing age due to its role in preventing neural tube defects, NTDs, in developing fetuses, supporting overall reproductive health, and aiding in essential bodily functions. Here's a breakdown of its importance. 1. Prevention of neural tube defects, NTDs. Folic acid is most widely recognized for its ability to significantly reduce the risk of NTDs, such as spina bifida and anencephaly, which are serious birth defects affecting the brain and spinal cord. These defects occur in the first few weeks of pregnancy, often before a woman knows she's pregnant. The neural tube forms the foundation of the baby's nervous system, and adequate folate levels are critical for its proper closure. Studies show that taking 400 to 800 micrograms (mcg) of folic acid daily, starting at least 1 month before conception and continuing through the first trimester, can reduce NTD risk by up to 70%. 2. Why women of childbearing age? Since nearly half of pregnancies are unplanned, waiting until pregnancy is confirmed to start supplementation may be too late. Women aged 15-45, even those not actively planning to conceive, are encouraged to maintain sufficient folic acid intake. The U.S. Public Health Service and CDC recommend that all women of childbearing age consume 400 mcg of folic acid daily through supplements or fortified foods, in addition to dietary folate, to ensure protection against NTDs if pregnancy occurs. 3. Beyond pregnancy, general health benefits. Folic acid supports DNA synthesis and repair, red blood cell production, and cell division, processes vital for everyone, but especially for women in their reproductive years. Deficiency can lead to megaloblastic anemia, characterized by fatigue, weakness, and shortness of breath due to improperly formed red blood cells. It also plays a role in reducing homocysteine levels, an amino acid linked to cardiovascular disease when elevated, though the direct benefit of supplementation for heart health remains under study. 4. Sources and recommendations. Natural folate is found in foods like leafy greens, legumes, citrus fruits, and liver, but it's less bioavailable and can be degraded by cooking. Fortified foods, example cereals, bread, and supplements, provide folic acid in a more stable, absorbable form. The recommended dietary allowance, RDA, for women 19 and older is 400 mcg of dietary folate equivalents, DFE, increasing to 600 mcg DFE during pregnancy and 500 mcg DFE while breastfeeding. For NTD prevention, a daily supplement of 400 mcg folic acid is standard, though women with a history of NTD-affected pregnancies may need higher doses, example 4,000 mcg, under medical supervision. 5. Risks of deficiency and excess. Folate deficiency is relatively common, especially in diets low in fruits and vegetables, and can be exacerbated by alcohol use, smoking, or certain medications, example anticonvulsants. While folic acid is generally safe, excessive intake, greater than 1,000 mcg per day, can mask vitamin B12 deficiency, potentially leading to neurological damage if untreated. However, this is rare with standard supplementation. Practical takeaway. For women of childbearing age, folic acid supplementation is a simple, low-cost, and highly effective way to safeguard potential pregnancies and support overall health. It's a proactive step that aligns with the unpredictability of conception and the critical early stages of fetal development. If you're in this age group, a daily multivitamin with 400 mcg of folic acid or a standalone supplement paired with a balanced diet is a solid strategy. Whether or not kids are on the horizon,